Hello, welcome to Dr. Friends. Please like and subscribe.
Turtleneck!
The mental hospital is popular. Many people like it.
I know, right?
We're not great at doing live or streaming often, but we try to communicate through our content like Who Am I, Dorothy, and the Stuffed Animal Mental Hospital series. We're preparing those now. You even recommended Nevermind.
I stopped the tutorial because I got too dizzy.
The game makes you dizzy. 3D. Then Chang Yun can't not live.
Once I stabilize after the tutorial and after the Stuffed Animal Mental Hospital, I'll try Nevermind. Which stuffed animal should we do this time?
We've rotated. The turtle's too noisy. Keeps beeping. I thought it was my phone. Maybe his hearing isn't good.
I'll try.
He's still exercising.
I explained MSE before, right? Mental status examination.
When observing a patient's general appearance, you'd see someone continuously jumping rope. My age?
How old? You never know. Last time there was a crocodile in the box. Saying my age is just a habit.
Isn't it always? I seem younger than my age, didn't really do it. Age hygiene?
They keep turning off the alarm like a healthy turtle. Whether it's a stopwatch or an alarm.
I suspect OCD.
Feels like exercise fix. I feel like I have to keep doing it.
OCD is chronic.
It starts in adolescence. For males, teens. For females, 20s. OCD is when you involuntarily repeat actions or thoughts.
Seems common, like OCD hand washing.
Organizing things, right? With OCD, you might wash your hands multiple times a day or need everything to be aligned or repeatedly check if the stove is off or the door is locked. This can be seen as compulsive behavior. There's also obsessive thinking, like having inappropriate or aggressive thoughts. Even though you don't intend to, you might keep feeling like you'll attack someone or keep looking at someone's body. The characteristic of OCD is that it troubles the person. They find it irrational and unreasonable, but continue doing it. They want to stop and have opposing thoughts.
Thinking no. It's locked repeatedly. People with OCD often come to the hospital, but when I look at this turtle, it seems anxious, just calm. Anyway, it seems we need to check. Maybe there's no medical examination. Sometimes it can be chosen or not, like in an interview.
We need to interview him.
We can't put him to sleep. He's saying something. His biceps. He has biceps? What you'd call healthy?
A gym newbie.
Where to? Hard.
Can't hear at all. But it seems like he's showing off his strength, feels strong, but actually isn't.
With that wing.
But he can't climb well. Delusion. It might be. He might think he's very strong, and the cause could be this again. Feels an intense pressure to be strong, which could lead to such delusions. Anyway, we need to analyze this later to find out the cause, since that's the purpose of this game. But the biggest issue is if someone exercises without rest like this. They could get exhausted, or what is it? Rhabdomyolysis, the muscle breakdown.
We should check urine color.
We might need meds.
No rest yet.
In waiting room 2, saying he's strong and doesn't need meds.
Not the nose, but the head.
On the head.
Not working?
Slowed down.
No difference.
Pupils dilated. Get faster. A delusion.
Seems he's pushing himself harder, insisting he's fine, trying not to sleep.
Let's test urine.
Compensate.
Compensate. What is this? Wakes up with alarm. Do what? Again. Skipped it.
Analyze dream. His eyes look sleepy.
We need to get him to sleep. He must rest or exhaust himself. He's not sleeping. You tell his eyes. Alarm.
The clock
33, 34 sec.
in a house.
A car.
Or water.
There's a clock and a doll drawing. Maybe add more detail.
Hands shaking.
Can't lift it.
A person.
What is it?
A bird.
Ah, it's a bird.
Lots of birds are coming. Clock dings.
Clock's loud.
Clock wakes me.
Working out again.
Must work out. Scary if someone did this.
Let's see what you'll draw.
We need to explore the subconscious. Why does he keep hitting his ear? Why hitting here? One ear deep.
Clock tinnitus.
Auditory hallucinations run.
Not drawing.
Not drawing.
What now?
It's not easy. No more motivation.
Therapy progress dropped. Medication.
I'll give more. More medication.
Not allowed.
But works. Refuse this too. Strong.
On his head.
Same as before. Eyes bigger. Faster. Faster. Faster, faster. Collapses asleep.
Curious story.
Feels like dying. Exam. Didn't do this. Didn't do it really.
Didn't press.
What? It's different.
This didn't show up earlier, right?
Didn't show up.
Conspicate steal. What's this? Taken.
Not a psych term.
After sleeping.
Psych's term.
Clock keeps him awake. Interrupting entry.
Dropping it.
Isolation.
Clock rang and woke them.
Right.
Awkward without the clock. Turned it off, exercised. Trying the dream again.
Right? Since we got
No
rid of the
clock,
clock, I don't think they'll wake up. Tell us to go. Oh, it works.
Yeah, this guy doesn't close his eyes.
Turtles stand.
No, they sleep lying down.
Ninja Turtles. What are you saying? Scary like a painting. Faceless woman came.
The clock stopped.
Yeah.
This is
Portraits flipped.
the clock stopped since we removed it.
Eye.
Chalk drawing.
Another clock, hourglass again. Past the clock.
That's right.
Is chased by time.
We must go. Slower.
It stopped. It's nerve-wracking.
Related to trauma.
And the turtle is falling.
The clock is falling. The hourglass is falling. It feels like you are falling. Anyway, in dreams, falling signifies something negative or death.
Huh.
Got discouraged.
Took jump rope.
In the end, couldn't meet the goal. Just like that. It seems to have caused depression. Just like now. Earlier, he said he's strong, but in the dream, he realizes he's not that kind of person.
I see.
Seems timid. Deeply depressed.
It's red.
Red. Feels worse. Interview? Discuss again.
Red. Totally negative.
Turtles hide in shells. And breath like this when scared.
Can't talk.
Too shy. Can't even
right.
inject now. Should we give some motivation at times like this? Encourage them.
Bad state. Can't press motivation. Usually goes in nose.
What injection to give now?
It's injected.
Firm injection.
Eyes enlarging.
Oh, butterfly visions.
In really severe cases, they might not move at all.
For me, well,
I think earlier was mania, not OCD.
now I think it might be depression. When manic, there's a lot of energy, and even if they're tired, they don't realize it, and they engage in goal-oriented activities.
That's the state. And like Dr. Chang Yoon mentioned, there's delusion like I'm strong. But when that breaks unconsciously, it seems to shift to depression.
So we say recovering from mania is more dangerous when it drops into depression.
Nothing to do? Ask for help.
Advice, I missed it. There's something here.
What is it?
He's almost in a stupor?
What is it?
Oh, it's ECT? It's electroconvulsive therapy.
It's common.
Intense. Smoke coming out.
It's misunderstood, and people fear ECT. There's One Flew Over the Cuckoo's Nest. Jack Nicholson showing barbaric electrotherapy without anesthesia. ECT is effective?
Oh, really? It's quite common in university hospitals, especially for severe depression where the patient is not eating, doing nothing, completely lethargic, and requires acute treatment. It's used in cases of severe aggression, suicide attempts, or self-harm. Nowadays, an anesthesiologist administers general anesthesia, so the patient feels no pain, and it's widely used in the West too. It's considered for elderly patients with severe depression and pregnant women where medication is tricky.
Safe for pregnant women, huh?
It's safe. Committees decide on it, and both guardians and patients give consent with anesthesiologists present. It's never like that. I've done over 200 times for my patients and improved immediately. My first patient did nothing for 3 weeks, had delusions, thought she was a lawyer, but improved right after one treatment.
She even started participating in interviews. The effect is really good. So, anyway, I've done some electrotherapy.
We can try now, right?
Shall we try dream analysis? Facing the dream unprepared seemed to worsen symptoms. But now we're a step forward.
Stuck in a clock, right?
Indeed. Can't reach it.
Seems there's time pressure.
Sinking underwater. That's really
In
short.
dreams, water usually symbolizes something.
I slipped and fell again. Represents the unconscious, but maybe too weak now.
Can we talk? We chose red.
Try again.
This is tough. Needs about 8 to 15 sessions.
It's improved.
It is?
Not 8 sessions for ECT.
Back again. Avoid reckless analysis.
Try music therapy.
Feeling a bit down now. What if? It's Jambay. Was about to ask if they play rock.
The crocodile played a flute.
Can't touch it. Energy's really down. So different from before.
More like bipolar.
Energy. I can't muster it yet.
Head hit.
No strength in hands. Physical exam showed no issues. We lifted hands. It was funny. I was strong. Now very lethargic. Actually, exercise therapy is what we find effective.
Exercise.
I always say.
Yes.
In mild depression, exercise helps, and combining exercise with medication is much better. Though this isn't a mild depression. It's a really severe lethargy and depression, but still, if we try something here,
Exercise.
Let's try exercise therapy.
If patient participates, might help.
Balloon.
Grab that. Seems like it.
Descending slowly.
It's like interested.
You magic.
Showing interest.
Just lethargic.
Exactly. Needs fun. Is this exercise?
Oh.
Wow, so chick. Reaction.
Fun exercise.
Actual exercise therapy, isn't this?
Not like this.
Running, strength training, and yoga are said to be helpful.
Seems effective.
Enjoying it. Kid likes it.
Getting worse.
More than before.
One bar earlier. It went up a little, didn't it? Still the same?
Still the same. Burst.
Paint therapy.
Paint therapy.
Analyze it. Paint therapy seems more for exploring the subconscious mind. You're not going to draw this?
Not drawing.
Not easy.
Really slow, right?
Earlier.
The kid who was fast is now slow. Even his hands shake. Really feels like his body isn't his.
Really struggling.
Even washing your face or eating is hard in severe depression. So telling someone with depression to go exercise or meet people is unrealistic.
It's unrealistic.
Each of these things is like a mission to them.
But he draws.
What to draw?
Draw a clock.
That makes sense. Earlier he was falling in the hourglass. And then inside the clock.
First was a beep beep clock.
Oh, right.
The clock keeps.
Trapped inside like a balloon.
He's trapped inside.
And this,
Balloon's meaning.
We gave it.
exactly. No balloon in the dream, right?
Yeah. It keeps getting worse. Nothing's improving.
Let's check the dream.
It's like halfway up now.
I think next story.
Trapped inside. But clock still.
Clock trap.
Huh.
Balloon
Balloon
rising.
up? Where?
It doesn't seem like it's underwater. I think the balloon. I thought it would lift him.
Ah. Oh, he escaped.
Looking at balloon, rising. Got one now. No shell.
That's right.
The shell is something safe that protects him.
The shell disappeared. Shell's gone now.
Huh? It's coming out.
Do you think
It's
this is
coming
something
out.
that binds you?
Like it.
He looks happy and energized. His belly's out.
Ran.
Maybe normal. Turtle sees belly, embarrassed.
Embarrassed, huh? What? Sand.
Hourglass.
Sand came out. Thought it was something.
Well, something like urine. But it got bigger, right?
Yeah.
Yeah.
Exercise
better.
therapy.
Sure.
Seems depressed.
Ah,
Gave a jump rope.
Could be risky.
it might repeat again.
Doing well without a clock.
Right, earlier.
Huh. A dream,
What?
right?
Boxing.
Turtles don't walk on two legs, right?
Right. Not Ninja Turtles.
Is it the sand from here? It seems like it's from here.
The sand was here.
Yeah.
In the sand.
Plane.
Plane sounds like a kite. What?
What?
Oh. That's the airport from that portrait earlier.
It dropped. It dropped.
It dropped.
Ah. The kid's running.
His owner.
Back from a resort.
Ah.
It's so birds don't hit the glass.
When the window opened.
Was that guess the one who
Bumped into.
Ah. The faceless one. Now he's blaming himself.
Oh dear.
In the end. Oh, it's bigger now that I see it this way. Oh, went to the resort. Sand here, had fun. On the way back, someone bumped into the owner, turning it upside down.
Right.
If I had run faster here, I might have caught up to the owner.
I see.
I would have caught up with him, but I couldn't. And now he's blaming himself. In that situation, running is tough.
Right? A small turtle, intriguing. The owner seemed to be rushing because the flight time was probably quite tight, you know.
Had to, but couldn't.
Mania often acts as a defense against past sad memories. When talking to bipolar disorder patients, it's common to find that they have many unpleasant and sad memories from their past due to this manic defense mechanism.
I'll try to analyze the dream.
There's all tissues gone.
Oh,
So many tears. More
turtle.
bipolar than OCD?
It seems fitting now. The exercise obsession is still there.
Huh? The earlier dream.
Dream of meeting.
The owner's flipped, right? Owner resentment.
what? Watch.
Flipping the owner means denying them with resentment.
Oh,
Goodbye, take care.
Left after giving the watch.
what?
Sprouting means happiness and hope and a new beginning.
But if it's inside the hourglass, then
So it's home. This turtle shell, but losing it, wandering a bit, then inside the hourglass given by the owner, it unfolds. And eventually, this escalator, at any rate, goes backward. Now, heading forward.
green earlier, green in the dream. It's brown now. Any difference?
That,
It turned green.
Like that?
Flipped.
oh, flipped.
The shell.
Flipped over. Looks relaxed. It was double-sided.
Right.
Is it cured?
I think so.
Blaming oneself for the separation with the owner if I had exercised well. Mania, then treatment facing oneself. Depression, recovery. Trauma forgotten. Improvement, it seems.
In the end, it dreams again. The owner. A new shell blooming inside the hourglass. The new shell was green.
That's right.
The original owner, the orange one, has gone. But there's a new kind of home.
Could be
Found it.
separated from the owner. I'll check that color. Many like the plushy mental hospital, so we filmed again.
Next time.
We'll continue. Thanks.